Good afternoon. I'm Dr. Fred Venditti. I'm the Hospital General Director here at Albany Medical Center. I'm joined today by Dr. Barbara Ostroff, the Chair of Pediatrics and Pediatrician-in-Chief of the Bernard and Millie Duker Children's Hospital here at Albany Medical Center. We're going to bring you the update today while Dennis is away. Let's go to our first graph, as we always do. You can see regionally, there continues to be some growth in hospitalizations. We're at 96 hospitalized patients across the region today. We did have our regional discussion yesterday amongst all the hospitals, and it is interesting. There has been growth in hospitalization, but patients are not requiring intensive care or ventilators to quite the same extent, Barb, as they had been requiring back in the spring. Let's go to the second graphic. This is the circumstance here at the medical center, and you can see that we're at 22 hospitalized patients, so that's up from Tuesday and up from last week. 19 of those patients are on medical floors, 3 are in the intensive care, and 1 is on a ventilator. So that's our status today. Barb, why don't you share with us a little bit how the Children's Hospital has dealt with the COVID pandemic?
So fortunately, from the perspective of pediatrics, very few children have been sick with acute COVID infection. I think you told me 18 people under age 18 have been hospitalized with COVID during the entire time, and most of them have not been very sick at all. We did have about 14 children that we thought had the post-COVID inflammatory syndrome in children. The last one of those was actually admitted at the end of May, so we haven't seen any children with that syndrome since May. And while a few of those children were sick in the ICU, all have completely recovered with the standard treatment that's been out in the literature. It really was quite remarkable how sick some of those children were about 2 weeks or so after the peak of COVID in their neighborhood, in their area.
And Barb, your staff in the Children's Hospital also participated in care on the adult side, didn't they?
Yeah, so we actually took some patients up to age 25 in beds in the Children's Hospital, and actually one of the patients who had been transported here from Queens was a 25-year-old young woman with Down syndrome, and when she recovered from the severity of her illness on the adult side, she got moved into the pediatric unit, which was great for her from a behavioral and developmental standpoint. It was perfect. And then some of our nurses worked in adult ICUs. Some of our outpatient nurses went into the adult ICUs. So it was just a community, the amount of teamwork and the sense that we were all in this together. Even though there weren't very many sick children, we were all helping each other.
So Barb, in addition to the physical illness of COVID, there's been an effect on mental health in our region as well. Tell us a little bit about how that's affected the children locally.
So the quarantine, leaving school precipitously last March or April, and then the stress of not knowing what's going to happen next, or is grandma going to get sick, or what's going to be going on with school in the fall as we approach the fall, was very stressful to children, particularly the somewhat older children and a lot of the teenagers. And this is actually has been shown to be a problem across the state. Our hospitalists work collaboratively across what we call the Thruway Consortium, and every children's hospital, all 4 children's hospitals across the north part of New York State, are all experiencing the same thing. And so we're having a lot of children and teenagers coming to the hospital with behavioral health issues, mental health issues, the stress of this quarantine and the not knowing when it's going to end. All that is really having a great impact on our patients.
Hopefully, Barb, things will get better soon. Obviously, you've been describing what's going on with children. This mental health effect has been happening with the adults as well. Barb, you've been here almost 2 years, you told me before we started. You've done a lot of interesting things. You've made a lot of changes that have been really good for the Children's Hospital and the department. There's one in particular that I think our audience might want to hear about, and that's the Patient Family Advisory Council. Tell us about that.
So certainly throughout the hospital, and definitely in Children's Hospital, we want to hear from parents and families about what works, what doesn't work, how to do things better. They need to give us their perspective on how does a room need to be outfitted, which chair is comfortable. They have to sit in the chair for 2 days sometimes. And so the Patient and Family Advisory Council was a concept that we moved forward. We were ready to get started in February. Of course, we couldn't. And we got started remotely in June. And now we have meetings once a month. We have 8 family members and 6 staff members that are working collaboratively to advise us on the best way to do things at the Children's Hospital. So we've started slow. We are getting their advice on creating a behavioral space up on the 7th floor, for instance, for children who need to be in a safer space without things on the walls. They have advised us on how to write a brochure to give to families, to have language that is uplifting and thorough and done in a way that the families can really understand and relate to it. They have participated already in some of our quality programming initiatives and given us advice about their perspective on the quality indicators that we're working on. It's always eye-opening to meet with the family members and get their perspective. I think one of the most interesting things was meeting maybe 2 months ago where we were talking about our multidisciplinary clinics, which we think are great because you've got specialists from multiple services coming and the kid is there and can see multiple doctors the same place. The kid doesn't have to come back once a week for multiple different visits. But the mother's perspective was actually it was very tiring for the child to have multiple doctors come in the room 1 hour after another hour. And it was not the way we thought about it at all, but totally important to get their perspective. It's a great program, and hopefully we'll be spreading it into the adult hospital.
You know, Barb, going out and asking our customers, and I know that's not how we talk about family
Yes.
and patients, but asking them what we can do better is such an important way for us to improve the care we provide.
Absolutely.
It's really terrific.
Thank you.
Today is all about children, so let me tell you a story and then I'm going to show you something. The story is about a 2-year-old in our community that went to see their primary care doc, and the doctor noticed that one of their eyes was bulging a little bit. Sent the child immediately to an ophthalmologist who diagnosed an unusual illness called Cook's disease, which I'd never heard of. I'm a cardiologist, though. The child needed to have laser therapy pretty quickly or the child was going to lose their vision. And of course, before they could go to New York City for this very specialized treatment, they needed COVID tests. So they were swabbed in Saratoga. The test was brought down here. We didn't know that this was a test that needed to happen quickly. The family called us about 5 o'clock the night before the visit and asked where the result was. And just through the efforts of a lot of people, we found the swab, ran it that night, and then going above and beyond, one of our VPs, Megan Wigan, at 10 o'clock at night got the result, emailed it to the parent, so 8 o'clock the next morning that child could have that therapy. The issue for that child is that the longer that syndrome went on, and we're talking about hours and days, the more vision loss they were going to have. So this happened in such a quick time frame that the child actually still has some vision. So shout out to Megan and the staff and Molecular for doing such a great job for that child. It's who we are here at the medical center and the Children's Hospital.
Support the community.
That's right. So I said I was going to show something as well. Some of you remember back in the spring that there were a brother-sister team down in Connecticut that did their own version of the Fred and Dennis show, or I'm sorry, the Dennis and Fred show. Danielle, and I've got to look, I always have a hard time saying her name, Yesa Naya, did this YouTube video. And
great.
I must say, they did a pretty good job
We
of
loved
imitating
it.
us. It was terrific. So they have a future in television, but also Daniela has a future in publishing. This is his most recent book, It's entitled All About Honeybees. He was very careful to point out that this is a bumblebee on the picture in front, not a honeybee. But this is a very well done, authoritative book on honeybees. He did the pictures as well as writing the words in the book. I highly recommend it. It's very thoughtful, very well done, and I think he got an A on this project at his school. So shout out to him and his sister. So that's the update today here from Albany Medical Center. As my colleague, Dr. McKenna, likes to say, take care of yourself and take care of each other.
Thank you for inviting me.
Thanks for being here.